This week on the Evolve to Perform podcast, we took a field trip and had the pleasure of having Jeannie Bozza, RN, CEO, and founder of Commodore Concierge Nursing.
Jeannie is also a matchmaker and a diplomat in her spare time.
We discussed
how Jeannie started as a one-man team and was able to scale to a team of over 250 nurses, offering kick-ass service to patients in the US and now Canada.
How Commodore stands out,
what hospital at home is,
the importance of a holistic and team approach to treating patients,
and the lasting legacy that she hopes to leave.
So hop in the car and let's go to NYC. All right, welcome back, guys, to the Evolve to Perform podcast. I am Kingsley.
I am Jordan.
And today we are so privileged to be here with Jeannie Bozza, CEO of Concierge Nursing. So welcome, Jeannie.
Thank you. Thank you for having me.
We are so excited to have you today. Transparency, disclosure, Jeannie and I know each other. We've worked together on cases, with patients. And I've been able to see like so many good things coming from your team, all the interactions I've had, and all of the success that the patients have really found, through your attentive team's care.
Thank you.
Of course.
Thank you.
Yeah, and so we really want to be able to just like share with our audience, our growing audience on Spotify, YouTube, and Apple Podcasts, just how amazing you are. So I just can't tell you how amazing it is for you to be here and for you to invite us into your space.
Thank you.
So we're gonna kind of like start off here, Jeannie. I want to know your origin story. Okay, there's always a backstory here that we have to know about because it's clear that you would not have done this for no reason.
Yeah.
All right, so just tell us a bit.
So I'm an RN, cardiac ICU nurse for 25 years, 10 years in the concierge industry, and it was kind of fluky. I think it's like any good situation, right? It's being able to recognize an opportunity when it crosses your path. And so I was working as a cardiac ICU nurse. I was out and about somewhere, and someone said, "Too bad you're not a nurse. You'd be great for so-and-so." I was like, well, actually, I am. And so I became the concierge nurse for this gentleman, and he really thrived under my stewardship. And he was really it was exactly the kind of care I always wanted to provide. And it was why I had originally gone from a regular floor into the ICU, because in the ICU you only have 2-to-1 nursing, right? Or sometimes 1-on-1. And so I could really give the care and time and attention that I really wanted to. So now here I am doing it in a home setting, and there was no constraints by insurance. It was all private pay. And so what I could do for this patient was what was needed, not what the insurance company said we could. And so it was an unbelievable experience for me. It was a great experience for the patient. And then the patient gave me 5 referrals. And then those 5 people gave me 5 referrals each. And it just very quickly blossomed out into something really amazing that I could never have dreamt up. I'd love to say I was smart enough to figure this out. That was not the case. Yeah. But I was able to recognize the gift that was being given to me when it came across my doorstep. Yeah.
Hey, look, it's like, right place, right time. Kind of situation.
Yeah.
Okay.
And I think giving your all in everything you do, when you do that, you're successful in whatever you do.
Yeah.
Right?
Yep.
So I got so busy that I had to bring my girlfriends in. I couldn't be everywhere all the time. Yeah. And so I brought in my girlfriends, and then we got so busy together that I was working 400 hours a month at the bedside, and then also doing contracts and insurance and like calendars and getting all of that squared away. So I ended up going to my girlfriend saying, "Guys, I can't keep up at this pace anymore." Yeah. And I said, "I think I have a plan. I think that this could be our real full-time jobs. We could leave the hospital and do just this and provide quality, exceptional care." And they were all like, "What are you talking about? We're not, we're not business owners."
Yeah.
And so I was like, I can show you. But one of the things that was really important to me is I never wanted to make money off my friends. And so I said to them, I want you all to be on the same playing field as me.
Amazing.
You're all going to be your own business owners, and I'm going to show you how to do it. And that way, I'm not the boss, we're all on the same page. And so everybody thought I was crazy, but everybody took the leap with me. And then I said to them, if all of you thought of the person that you would call if your mom was sick, the one that you would call that if you couldn't be there, everybody had a smile on their face, everybody had a twinkle in their eye, everybody knew the person I was talking about. I said, if each of you sends me one person, we will double our team. Most people sent me one or two. And we tripled our team in 3 months, and 3 months I tripled our business.
Unbelievable.
So the really special thing about our company is that the team built the team. I started with my best friends, and now I have duplicates of all of them because they all sent me the person that they would let their mom be taken care of by.
Right.
And so this entire company has been nothing but a gift. I mean, the people that I get to work with every day and surround myself with are just exceptional individuals.
That's incredible.
Yeah.
That's incredible. So it's like, so this is the thing. It's like you became viral before it was cool to become viral. Right? Like, I mean, that's insane.
Yeah.
You know, like, okay, so yeah, I mean, and it's amazing. It's interesting that you said too, like, think of that one person who would want our care. I mean, that's exactly how, like we feel too with us. It's like if I have a conversation, maybe with a physician, all right, be like, we're the person that you want to go to if you had an injury, if you need to rehab. Like, so think about that when you are sending somebody to us, or think of that person.
Yeah.
And so like that's so funny that you said that.
Yeah.
But yeah, I mean that's amazing. And so yeah, you quickly found out that like you couldn't work for the man anymore. Like you would, and like now you're creating yourself like this like pretty awesome empire.
Yeah. It really was about it was really just about exceptional care, and that's never changed. We treat every single patient that comes to us as if they're our family member, and we will fight tooth and nail to make sure they get what they need and they deserve. And so that's really, again, it just came from a good place,
Yeah, no, for sure. And I'll testify too that I can see you guys find tooth and nail for the the best care, best scenario for all of your patients, because I've seen it firsthand.
Thank you.
Yeah.
And that's why we involve ourselves with you, though, because you do the exact same thing. I remember the first time we ever met. We met on Long Island at a home of a patient who was post-op, and the stuff that you brought in, and you were so ahead of your time, which was almost scary to some extent, right? Because a lot of people weren't that far advanced yet. They didn't know. And so it was very much, even just for me, a learning curve to learn what you were showing, and then get the physician to be on board with doing it, and but I think that's why we get along so well. You seek out exceptional care, and so you're always going above and beyond to learn the next best thing and to take a patient further. We've seen that over and over again with you.
Yeah, no, I appreciate that, and that's why we're here. That's why we're here together, right?
Yeah.
Well, as Kingsley mentioned, you're the CEO of Commodore Concierge Nursing. So, what do you do for your patients, like exactly? Like if I was just someone on the street and I was like, oh, what is this?
Yeah. So we are a team of 250 ICU nurses. I really hire ICU nurses because of their exceptional skill sets and their assessment skills. I mean, there's no better assessment skill than that of an ICU nurse. And we do really complex things at home. We perform hospital at home. So before that term that became very well known now, hospital at home, we were doing that. Because I really felt that once a patient went to a hospital, you lose a lot of control, right?
Sure.
And so you get in there and it's a rotating door. You have different shifts, people are not following through, or you'll have the same physician on day shift for 4 days and then they're off and now you're starting all over again, and people are, the consistency of the care is just not there. And a lot of the times I find people work in silos, and that's really where it breaks down. So we really try to avoid the hospital. And so the only thing that I really go to the hospital for is if I need MRI, CAT scan, or blood products. Those are our hard stops. Outside of that, we do x-rays, ultrasound, lab work, IVs. We do PT, OT, speech, all of those things at the home. We run ventilators. we really try to keep everything under our umbrella because the physicians we're working with are not working in a silo. It's extremely collaborative, and they're getting real-time data from our nurses all day long. So they're able to make real calls in real time, which prevents problems, right? So if we know our patients so well that we know that something's just a little off, like I have one client that every time his sodium level drops, he becomes a curmudgeon. And you can tell because he's just a little off.
Yeah.
So I'll draw labs right away and say soy sauce stat, which is a silly thing, right? Like soy sauce, but it brings the sodium level up, and you didn't need, crazy salt tabs and all sorts of stuff.
Right.
So a lot of medicine is really just common sense and being very aware of the person you're taking care of, what their baseline is. And so for us, I would say the biggest thing you'll get from us is consistency. Our teams are really small because as a nurse, I think that's really important. We don't exceed 4 to 5 people, but those are consistently your only people. You'll never get somebody who calls out sick and then you're getting a different person. You're getting the same person that you would have gotten, at some point that week, somebody you already know.
Yeah.
So that's really important to us because also our physicians are depending on us to know that patient in the home to give them the right information for them to make the right call, But then we don't just stop at nursing. We do cooking, cleaning, laundry, driving, making appointments, advocating for the patient and the family with physicians. It is truly concierge care. It's fully tailored. There's nothing that we won't do to help them, whatever that is. I mean, a lot of our clients might have been the person who walked their dog, and now they can't. So we're walking the dog, whatever it takes to get them to be whole again. I think the other thing that makes us really different is we look at the whole person holistically. We don't just come in, you'll hear some nurses will come in and they'll just manage meds, right? And they won't think outside the box. And so we do a lot of traumatic brain injury. So you'll have neurosurgery, and instead of going to a rehab, I'll take you home and set that rehab up. And my nurses do PT 3 times a day, speech 5 times a day, OT twice a day. So you're getting a much more intense version of what it would be in a rehab setting, but it's also being done around you. Like if you're in a rehab and you're napping, PT will come by and just say, well, you missed your chance. And so PT is really important in recovering from these different illnesses, right?
Yeah.
So we're like, great, you're napping, wonderful, because when you wake up, we're gonna have peanut butter, and we're gonna give you a little more energy, and you're gonna get up and you're gonna work harder for me, right? Like that's a good thing.
Yeah.
So we just approach things very differently. Anybody who really meets me probably had a bad day, right? There was probably something bad that happened, and that's why you called me.
Yeah.
So there's a mental component to that. We look at the mental health piece. You can't push a patient to recover and do all the hard work that's needed if you're not in the right mental space. So we address that as well. Nutrition, the body is a machine. It's only going to work as well as what we feed it. And so we hyper-focus on nutrition. We have a nutritionist on staff. Our patients that have PEG tubes, where they're being fed through their belly, we actually do not use formula feed. We use real food. The nutritionist makes a plan, and we purchase, cook, and puree and put real food down those tubes. Last year we had 3 of them removed, which is unheard of, because once you stop using these muscles, you don't get them back. So when I'm giving you what the body really needs, salmon, sweet potatoes, broccoli, all the good stuff, right? Liver. I mean, we've corrected
Don't get me started on liver.
right? We have corrected so many people's anemia problems by utilizing liver. Like there's one client that was getting transfusion after transfusion after transfusion. We used liver through his PEG tube. Everything's corrected. So it's common sense, though, to me at least, because think about it. Every hospital, every rehab has a nutrition department. Why are we not doing that? I'll tell you why.
Yeah.
Because it's not going to be backed by insurance. It's going to be a lot more time consuming. It's going to require more people involved in the care, like nutrition, and more lab work to keep it on par. That's why. It's not time effective for a nurse to be standing over a patient putting real food down there. So it's a very different type of care. I just believe it's what we all deserve. Excellence. It's what you would want for your mom or your dad.
Absolutely.
100%.
For sure. Yeah. I mean, it's just those frustrations of, kind of having to deal with all the red tape, that takes time. And then, of course, with time, there's expenses and all these other things, and then frustration on top of that, So yes, all these things allow us to, let our patients heal actually in the right amount of biological time that they're supposed to, instead of being that impediment towards that.
That's a really valid point. It's based on what it's going to take for this body to recover, not how long they can stay in the rehab or the hospital.
Yeah.
Yeah, because there's so much more when you leave there, right? Like there's so much more work to be done, and unfortunately, these patients go home and they fall off the face of the earth to the medical community, and then they often go down a very negative path, right? Like they don't get better, or a body part becomes frozen because they didn't do the PT, nobody followed up with them.
Right.
I think that is a really valid point that you just made.
Yeah, thanks.
At Commodore, how would you say the patient experience is different in terms of accessibility?
I would say that we are beyond fortunate to work with the physicians and have the network that we have. We literally work with the best in every single field. One of the most beneficial, I would say, relationships that I have is with my partnering physicians, the concierge doctors that are doing primary care. But then another really large part of that is Pinnacle Care. Pinnacle Care is a company that manages people's medical needs. And they have access throughout the U.S. along with overseas as well. And so most recently, I had a situation happen with one of my own team members. She had stumbled upon a diagnosis, essentially is what happened. Her physician wanted to put her on a cholesterol pill, and being that she's a smart ICU nurse, she was like, I would like to see what my calcium score is beforehand. And so when she went for the scan, they stumbled upon what looked like something was lighting up on her scan. And so she took it to the next level and then found out that there was a tumor in her kidney. And she needed to have her kidney removed. And she had the kidney removed, but then they lost her slides. So now she's 6 weeks after having had the kidney removed, and she wanted to know what the tumor was, right? Yeah. So they couldn't find the slides anywhere. She goes I think it was probably another 4 weeks, calling everywhere, trying to find them, no help. And so then she finally came to me and told me what happened, and I was like, what are you talking about? I was like, we'll get my attorneys on the phone, we'll start sending the appropriate letters, we're gonna get your kidney.
Yeah.
Like, this is insane, And so we were able to find her original kidney, not just the slides that were sent off, because at this point I didn't really trust the slides, right? Yeah. And so I was like, I want brand new slides performed on the what's left of the kidney and the tumor. And I had the great fortune of being able to talk to Pinnacle Care about this and finding who is the best place, or where is the best place for us to send this to get definitive results, right? So we sent it off to the Dana-Farber, and while that was processed, they found these slides in Florida, and they came back with a reading on it, and they basically said, not to worry, you don't need to do anything else. But we just had this feeling in our gut that, obviously we were still going to continue down the path we were, but we said, you know what, let's get a PET scan. Let's just cover all our bases. You've really been through it, right? So let's just make sure. So we did the PET scan, and now we found something lighting up in her abdomen, which wasn't too far off from where the kidney was taken, right? So we're like, oh goodness, like if we had just stopped, right? If we had just stopped where we were and taken that read for what it was and then not done the PET scan. So she sees a physician on Monday in Florida, and I have an appointment with her on Friday. And so she's going up to Boston to see the physicians on Friday. And I'm like, babe, I don't really think you should go to this appointment on Monday. I just think that we should just wait for the experts. We don't need to. Sometimes more information is not better information. It's just more, right? And it gives you something else to worry about. And you sometimes just need to lean into what your real plan is, right? So she goes up to, she goes to see this physician in Florida, and he tells her that she has a year, 2 to live. And I'm like, he doesn't even have all the answers yet. Like, we got our slides back now, and what we got back was much worse than what the read was that Florida gave. And so we don't even have all the additional slides that we're now we're asking for extra tests, right? We want all the different pieces. How do you tell somebody that they only have a year to 2 to live when you don't have all the pieces? Right?
Yep.
So she's devastated. She's got to wait 4 more days before she gets to see a true expert in this field. And you're never going to believe what happened.
What happened?
Pinnacle Care had her treated like a VIP. You know, she walks into the facility, there's somebody waiting for her. One of her biggest complaints was in Florida when she went in to speak with that doctor on Monday. She sat in the same room that all the poor patients that were going through chemo and radiation sat through. And so here you are just trying to get a consult on something, and you're seeing what could be your future, which is very scary, right? That day she said I had to take 2 Xanax before I even got into the appointment. You know, now she goes to Boston, and they meet her at the doors, and everything's very, you know, calm and soothing. There's a room for patients that are only having consults, so nobody in there's sick, right? So you're not feeling that sense of dread. They go in, they wait for the physician, and the physician's assistant comes in and says, you know, the doctor will be right in. We're just doing one more look at everything. And so the physician comes in and he goes, I've heard you've gone through a pretty rough time. He goes, and I'm just really happy to tell you, you're fine. Wow. And she just starts hysterical crying. And she's like, what do you mean I'm fine? Like, I was, you know, 2 days ago, they're telling me to go get a port placed and start the worst chemo anybody has ever had. And he says, no, I'm telling you, our radiologist says that that's a luteal cyst. It's a cyst on an ovary that's lighting up. That this is not cancer. This is not a MET. Like, you don't need further treatment. Because the tumor was encapsulated and in the kidney, yes, we're going to keep a close eye on you. We're going to do scans and things like that for the future because you have this propensity for this type of cancer. But now that we know about that and it was encapsulated, absolutely not. There's no further treatment needed. This poor woman went through, like, she has 9 children.
My goodness.
Yeah, she has adopted 4 children.
Oh my God.
Yes, in order to help out other families. And she's the most giving individual you've ever met. She's 40 years old, and she was literally sent home being told you have a year. Like, unbelievable. But meanwhile, you take them to an expert, and the expert's like, we see this every day. She was hysterical. They were like, let us just go speak specifically with the radiologist. And the radiologist came in and said, I guarantee you that's a luteal cyst.
Wow.
And you know what happened? 2 weeks later, she's in Florida. She's really loving the team that she got out of Boston, and they're following up all the time with her. Everything's great. And that physician from Florida calls her.
Oh boy.
And he gets on the phone with her, and he says, sorry for the scare I gave you 2 weeks ago. And he chuckles and says, our tumor board came back and said that that's a luteal cyst.
Oh my gosh.
Can you imagine if she had not gotten a second opinion? She would have already started treatment. He had advised her to go have her port placed and they could start treatment that week.
That's unbelievable. Like, I mean, like, just even as you're telling this story, I'm thinking, like, you know, there's so many, so many, I'm not going to say mistake, but so many things that they just didn't consider.
No.
Right, in this experience for her.
Yeah.
And I think, like, one of the things that to me is like, one is like there was actually like no emotional intelligence. Right. With the way that she was like treated, the lack of compassion, and then the downward spiral that someone can go into so quickly.
Yeah.
You know, so it's like that is like. I mean, that's just, I'm just mind blown. But
it's insane. She has PTSD from the event. She's in therapy now. It was, imagine being told that you're going to die. Yeah. Meanwhile, not the case.
Yeah.
You know, so the biggest thing I would say that we provide is that extra push, you know, to make sure that what we're doing is actually correct. This is the expert in that field believes that's the right thing to do, you know, because that's who I want taking care of my mom, the expert in that field.
That's right.
Right?
Yeah, for sure. And again, going back into someone who's got that emotional intelligence to be like sensitive to the way, you know, I think that's yeah, I guess that's where it is, you know, lies. And it's like, you know, you see the person as a person, whereas, you know, another place, another system might be like, you know, that's just another number. You're patient X and patient number whatever.
Just another MR number.
That's right.
No, you have to always look at, I think that's what we're most gifted with in what I get to do.
Yeah.
You always see the person.
Yeah.
And you have a connection with them. You're with them and their families, and you see what they're going through. And you try, I think what we really try to do is insulate them from these situations where the system is not really doing what it should, right? Like there should be a separate room for those patients that come
100%,
in.
yeah.
That's a lot to weigh on one person, and then to see what somebody else is going through and what it could be you next week.
Right.
That's pretty scary.
Yeah.
It had such an amazing outcome, really, truly amazing outcome. But I think that my biggest wish is that everybody in the world had those opportunities, because how many people who have been started on that medication that shouldn't have been?
Yeah.
You know?
Right.
That's scary.
Yeah.
Yeah. And would you say there's one patient story that stuck with you and shaped how you view healthcare?
So I would say being in the position that I am and getting to perform medicine on really an optimal level, right? Sometimes I can be hard on the system.
Yeah.
And so I recently had an experience where another one of my dear colleagues went away on a family vacation to Greece. And while she was there, she became extremely ill, and we had to fly her from Mykonos to Athens, because Athens has one of the better hospitals. And so she was there, and she's actually one of my nurse managers. She's an unbelievable advocate. She's very, very good at it. And she was hospitalized and couldn't get any information out of her. And I'm like, what's going on? Like, what do you mean you don't know what your labs are? What do you mean you don't know, what they're giving you?
Right.
And she was like, nobody will talk to me. And I'm like, what are you talking about?
Wow.
Like, is there a language barrier? Like, is that what's happening here? And she said, no. She said, they just won't speak to me. And so she was there for like 4 days. And we're trying to get information. We're calling over to the hospital. You know, I've involved physicians here in the US, and nobody can get anything. It was really odd. And so she's becoming sicker and sicker. And so I get a phone call from one of my other nurses, and she says to me, Jean, have you spoken to, Chrissy today? And I said, I haven't yet. It's 7 a.m. And she said, she just called me and said, I think I'm going to die here.
Gosh.
And I was like, what? Like, that's crazy.
Yeah.
So I called her right away, and she sounded terrible. She had 102 fever, and she's like, I can't get anywhere. I don't know what's happening. And I said, well, don't worry, I'm coming. And so it was 7 o'clock in the morning, and I was on a plane by 3. And in the meantime, my team called the U.S. Embassy. And so the embassy called the hospital and said, you cannot treat a U.S. citizen this way. And there's a nurse coming from the U.S. right now.
Wow.
And so I arrived, I left at 3 in the afternoon. I arrived the very next morning, I think by 8 a.m. or something like that. And I come walking off the elevator, and as soon as I got off the elevator, somebody said, are you the nurse? Like, they knew we were coming. Like, the embassy had made a way for us to get in there and to execute. And so I get in and I see her, and she just looks terrible, absolutely terrible. And she's in bed. And Kingsley, you know this. What do patients do when they're in the hospital? They lay around in beds. They don't get them up, they don't walk them, and then you get all these extra conditions outside of this,
Absolutely.
right?
Yeah.
So I instantly sit her up, I start my assessment. She's had fevers for days, not been washed, like, just imagine how terrible you feel, right?
Yeah.
Like, when you have the flu and you take that first shower, it's amazing. It's exhausting, but it's amazing, right? So she has a Foley catheter, and she's hooked to oxygen, and she's on 6 liters. I'm like, you're here for a gallbladder. What's going on?
Right.
Like, she had a gallbladder attack that ended up becoming pancreatitis. So I listen to her lungs, and they're garbage. And she's on 6 liters, and I just start chest PTing her, coughing, deep breathing, let's get it moving. I start lowering our oxygen. I get her cleaned up, wash her up, do a set of vitals on her, and I say, all right, babe, I need you to start drinking for me. I was like, water, like you need to hydrate now, because her Foley catheter's brown. So I'm like, is this blood? It's, like blood tinged because it's so dark.
Right.
She said, I haven't had anything to drink in days.
Unbelievable.
Yeah. So when you have pancreatitis, obviously, like you can't be eating and drinking, but they should have been at least starting her on fluids to drink, right? And so I said, all right, I want you to start drinking this. Don't guzzle it, but start drinking it. It was water. And I said, I'm going to go find the charge nurse. And so I went out to the charge nurse. Actually, right before I went out to the charge nurse, this is a good part of the story, the physician comes in. And it comes in with a credit card machine.
What?
Right. So here you are, 102 fever, you feel terrible, and your physician comes in with a credit card machine.
Like, I'm sorry, doctor, I only take Apple. How's Apple Pay? Does that work for you instead?
Right.
What?
So I say to the gentleman, hello, my name is Jeannie, blah, blah, blah. I said, we'd really like to get all of the labs that have been done since she got here, and any of the testing, any of the reports from the tests that have been done as well. And so he goes, no. And I said, what? It was like, the patient's right here. She's asking you, Chrissy, please tell him you would like a copy of. And she goes, I would like a copy of. And he goes, no. He goes, I can't give that to you. He said, only the head doctor can. And so I said, the head doctor that hasn't been in this room ever?
Right.
The person who's never seen this patient. You are the one that has been working with Chrissy, correct? And he said, yes. I said, have you seen her labs today? He said, yes. I said, what were they? He goes, I can't tell you. I was like, now I understood what this poor woman was going through for 4 days. I was like, I thought she was delirious. I'm like, who doesn't give you your lab? She's like, Jeannie, they come in and they hand me medicine and they tell me to take it, but they don't tell me what it is. And when I ask them what it is, they say the doctor ordered it. I'm like, what?
Wow.
Right. And so in discussing with her, she said that she believed that she was being supplemented for potassium. And you and I both know that potassium can create tremendous cardiac issues if it's given to the wrong patient, if you don't require it. So when I go out to the nurse's station, I asked for the charge nurse, and I immediately started with, I'm not here to cause trouble. I'm sure that you guys are doing a great job, but I need to speak with you, and I think we should speak alone. So she said, okay. So we go in a room, and I said to her, you're a nurse. I said, so you understand that you would never give potassium without looking at someone's lab work, right? And she goes, yeah. And I said, then why would you ask a patient to take something without showing them that? And a patient who's a nurse who knows the same thing you do.
Yeah, right.
I said, you guys have been probably doing exceptional medicine here, but the level of anxiety that you have created in the client that's being taken care of, they don't trust you anymore.
Right.
And that doesn't mean you're not doing the right thing, but how would we know? Nobody has showed us or told us anything.
Right.
I was like, so what I'm going to need from you is to get me a copy of everything that's been done here since we got here. And she's like, well, I can't do that. The doctor would have to do that. I said, great, because I just met his guy in the other room, and I told him I'd be happy to pay his bill, but not until I receive all of this. And so she was like, I was like, so I'm sure he's already gotten a call. He's probably already aware I'm here and that we will not be paying any bill until we have it.
Right.
And she was like, okay. I was like, and then I'm going to need a portable oxygen container. And she was like, okay. Why? I was like, because that patient doesn't belong in bed. And she was like, okay. And she grabbed the portable oxygen container, went in the room with me. I brought her, I got her down to 2 liters. We started walking the halls. She was fatigued. This is a 40-year-old woman in unbelievable shape, a runner, and she was in the hospital for 5 days, and I had to sit her down on a chair after going four rooms.
Unbelievable. Yeah.
Like, it was nuts. Absolutely nuts. By midnight that night, I had us signed out AMA and on a plane back to New York. When we got here, the New York City SWAT team actually helped me because I couldn't get oxygen I had to use oxygen on the plane, but I couldn't get oxygen from the plane to the car I had waiting to take us. So they called Port Authority, and Port Authority was waiting for me, came onto the plane, got me and my nurse off, and then got in the car, came here, and when we got to my apartment here, we had ultrasound, chest x-ray, lab work, IVs, and a concierge physician waiting. And we kept her here for 2 weeks and got her completely back to normal. She had a full-blown pneumonia when we got here.
That was my thought after hearing about the oxygen.
Yeah. Sure. Full-blown pneumonia. We offloaded 16 pounds of fluid. It was just ascites that built up from everything. Yeah. With no diuretics. It was just healthy nutrition and hydration and walking. So 16 pounds of fluid, I think, came off in 5 days.
Unreal.
Is that crazy?
Unreal.
And it was just basic nursing care, that if basic nursing care had been performed, she wouldn't have had these extra issues that occurred.
Right.
And it came down to this. Our system may be broken here, but it's the patient first.
Yes.
And then often the nurse and then the physician. There's a high level of respect for the nurse. And the reason that is because they're the ones at the bedside day in, day out. And if you have a really good nurse at the bedside, they're going to make the experience entirely different. And they're going to ensure that the physicians who aren't in the room all day long are aware of the problems that are happening, right? In Greece, the hierarchy was physician and then nurse and then patient. And the nurse didn't matter at all. Right. She was there only to execute on orders, not to give any real intel to anything. And that was really, I've never seen anything like it. Yeah. So I can complain as much as I want about the system here, but that system's broken.
Sure.
Because the patient is the last person that matters in that model.
That's right. Yeah.
Nobody is supposed to, the system is built not for someone to question the doctor. He was so far removed from the scenario here that it created all of these additional problems.
Yeah, it's amazing. The frontline people who are right there are not getting their input, their insights, just taken seriously or respected.
No.
Yeah, it's really unbelievable.
It was unbelievable to me that you could see these nurses are good people, but they have not had the opportunity to really flourish and use the skills that they had acquired in school. Because common sense says you get that patient out of bed. The neighboring patient was a stroke patient, 70 years old, was allowed to get up and walk to the bathroom, but my 40-year-old nurse wasn't allowed to get out of bed.
No.
How does that make any sense?
It does not make any sense.
It doesn't.
It does not.
So I think when you see something like that, and then you come back here, when we stepped on U.S. soil, the both of us took such a sigh of relief. Yeah. We looked at each other and I was like, have you ever been so happy to be in the U.S.? Like, if you are sick, this is where you want to be.
Absolutely, yeah.
It's unbelievable.
Wow. So, I mean, this is another wild story, and really appreciate you sharing that, because it's like, so now I'm thinking, like, while you're telling this story, in my head, I'm like, oh, so this is Jeannie. She's not only a CEO, she's not only a nurse, but she's a diplomat. Like, when did you become a diplomat, right?
I think concierge medicine, you have to be a diplomat, right? You got to get from point A to point B, but let everybody believe it was their idea.
Right. I mean, it's just amazing, like, but I can see you doing that. I mean, it's no surprise to me that you did all of this for your team. It's the same thing you do for your patients, but it's so wild. So diplomat, CEO, nurse. Let's see.
Maybe I'll add that to my resume.
Right? I mean, you should. I mean, it's like nonstop. So that's pretty awesome. That's pretty awesome.
It was an unbelievable experience, and I think it really renewed my faith in medicine here, because I think I was becoming a little bit jaded. I would get angry when I am in a hospital setting and feeling like people are just not getting what they deserve. But we are doing the best we can here, I think. Yeah. When you see this, it really makes you thankful.
Yeah, no question about it. Yeah. So, Jeannie, one other question that I have for you too is, like, what's your vision and hope for the future of Commodore? I mean, I'll let you take it from there.
Okay. Well, I think we're kind of executing on where we go next already. We just opened in Canada. So that was
Congratulations.
Thank you. That was a big undertaking and really exciting for the team. But I think one of the things that we're most excited about is our foundation. We opened our foundation last year, and we are essentially trying to provide the type of care we provide to all of our clients to people who would never have access to it. And we've already done a couple missions, which has been really, really great. We teamed up with Jonathan Levine, his Glow Good Foundation here out of New York, and Lenny Kravitz, the Let Love Live Foundation. And so we're in Eleuthera, Bahamas, working with the people of the island there. They have a dental clinic, both Jonathan and Lenny together, and so we're going to be opening up the medical clinic with them to be able to do both dental and medical together. It was probably one of the most rewarding experiences I've ever had, was going down there and triaging 343 patients and getting to talk to them all. While I was building this, I had to step away from the bedside in the last couple of years. And so I just fight fires all day long, patient advocating and getting things squared away. And every single patient comes through me. So I know everybody who's here, and I'm in charge of all the cases. But I don't get to put my hands on patients anymore. And you don't realize when you're just in the day-to-day and you're growing, right? How that piece of you is gone. Because I know I'm helping people every day, but it was not the same until I was sitting and doing a blood pressure or telling somebody they're in AFib, which they didn't know, and or sitting with a little girl who rarely sees doctors and who's scared, and getting her to laugh. Like, it was the most fulfilling thing. It was like I got a piece of myself back. And so it's funny, because I do believe every time you do something for a good reason, you get more out of it than you give. But I left that so fulfilled that I've never felt like that before, And so it's one of my favorite things to do is our passion projects through the foundation. And I think we're going to try to mimic that same scenario that's down in Eleuthera in St. Thomas, because it's a U.S. island. So I would really like to see us be able to do it for our own people as well, because it's a very similar climate.
What's the name of the foundation?
Commodore Cares.
Commodore Cares?
Yeah,
okay.
Commodore Cares.
That's amazing.
And we're open to any projects or anything that anybody is thinking of that they think we could be useful. Because we do have a team of physicians and nurses and aides and physical therapists, and we have a big team of people that just want to give back.
That'd be amazing. I would love to show people how to squat. And do a whole bunch of stuff. That'd make me happy. That's incredible. So is there other ways too that like people can support the foundation? Sure.
Anybody who wants to give time or be part of these missions, there's so many, even if you're not medical, there's so much stuff that goes on behind the scenes. We would totally welcome any help. And then obviously donations. Donations go far, and in these places, the money does go quite far. You're able to do a lot with a little. So, but anybody who wants to find a way to help, we can find something for them.
Nice.
Yeah.
Very awesome. Cool. Nice. So you have the foundation there, and that's really awesome. So I guess we even backtrack just a little bit, because I know you mentioned that now you're in Canada, but what other, so are you in all 50 states? Where are we here now in the United States as well?
So we do all 50 states. We've been doing that for many years though. But I think what's an interesting part of us is I don't have to have a nurse in your state in order to take care of someone. So we don't charge for travel time or travel expenses, and I don't base my nurse on who's closest to you. I base them on who's the best fit, personality-wise and skill set for what you're going through. And I think that makes us very different, because I can take my nurse from Utah and send them to New York because they're the best one for this particular situation. And that makes the care that much better, right? Versus just using the one who was closest to you, who's not necessarily the best fit.
Oh, so now I have another title for you. It's matchmaker. Right? So we got all these titles now. It's crazy. I love that too, because it's interesting. I actually enjoy. On the cases that we have a patient where it's I meet a nurse, I'm like, where are you from? I'm like, oh, I'm from Phoenix. Oh, cool. Well, Phoenix, what? We're in New York. And then it's I'm from Florida. I'm like, wow, so that makes a lot of sense.
Yeah.
It's great.
And each year we do a big company party, and we pick a different spot so that everybody has to travel at some point, but everybody has their home at some point too. And it's quite nice. Cool. And the turnout is huge. because everybody just loves to be together. It's such a good group, a good team.
Yeah.
Okay, so we have that. So we have all that information about the foundation, whether you see that. How about just in general concierge nursing the next like 5 to 10 years? Like, where do you see that going?
So I think, I don't know if you've seen, but Mayo Clinic recently did a project on hospital at home, where they had sent certain patients home with wearables and nursing and things like that. I think you're going to see that the hospital at home model is going to definitely be something that we're seeing more. I'm very interested to see how it plays out, because I do think we push patients out of the hospital too soon. And will this allow for us to have better oversight, or will we push patients out even sooner, and then maybe there's complications if there isn't full-time around-the-clock nursing.
Yeah.
So I'm interested to see how that goes. The study showed it was really quite effective. I personally think patients do better at home than they do in the hospital. You don't have the janitor coming in to wipe the floors at 2 a.m. You don't have the aide coming in at 4:30 to do your vitals, and then 7 a.m. the nurse coming to do her last med pass. Like, you don't get any sleep.
Right.
And you know this, Kingsley, that the body repairs the most when it's at rest, when it's
right.
sleeping.
Yeah.
So like, we're keeping these people up 24/7, and then we're like, why are you not getting better?
Yeah, I mean, for family members, relatives, everything else too, from, being around them, they can just come to your home as opposed to, there's a lot, yeah.
It's a completely different dynamic.
Yeah.
Also, you think about the elderly, maybe the elderly husband doesn't have the capability of getting to the hospital to see his wife. And imagine the worry and anxiety that he has not being with her. And imagine how she feels being without him. Now, if they're home together, that could also take a layer of anxiety out of it and make things better.
Yeah.
All those little pieces play a role in recovery. Yeah. So I think you're going to see more of a hospital at home scenario going. I also think that the concierge model is not going away. I think if anything, what we're seeing is that the concierge model is revving up.
Yes.
Because people are really starting to realize if you don't have your health, you have nothing. We have a real big push into longevity right now, right? That's another, I think that might be playing a slight role into the concierge side too, because people are really thinking ahead. They're not getting sick, right, and then dealing with it. They're really trying to think earlier not to get ill, or not to
That's right, yeah.
to fall prey to the things that other older people have, because
Right.
we haven't had as much education.
Yeah.
Right?
Yeah, for sure. For sure. I mean, there's that, we're going to have, I don't know, I think sooner or later we're going to have extremes on each end. We're going to have the people who are so proactive, and then unfortunately with like a lot of the, our dependence on technology, the lifestyle factors, and just all these things, we're going to have that other side of the pendulum where it's like, okay, now we're talking a lot of chronic disease. We're talking like sedentary lifestyle.
Right.
The Door Dashers, Uber Eatsers.
Right,
and,
yeah.
Which, I mean, it's cool, but, then, we just depend less on ourselves to do things. So, yeah. Okay.
That's a really good point. I never really thought about that. People are really becoming more sedentary because they don't even have to go out and pick up their food.
Yeah.
Yeah. That's a good point. A PT would think of that.
only like when I'm in my sleep, I think about that. So it's just obsessive around the clock. Yeah.
I think too, what we're seeing, I was just watching a documentary on caregiving, and the amount of elderly who are with us still, right, because of the advancement in medicine and technology. There's a whole new side that we're going to have to start addressing that we haven't, in the country. We don't have anything set up for these people who, don't have the funds to hire someone like me to come in and take care of them. So I think you're going to be seeing a lot more advocating within the government system too, to see like, how do we help these people? And because we're keeping everybody alive, but there's no quality if they don't have help.
Right.
So I think that's something you're going to be seeing too a lot.
Yeah, it'd be interesting to see how things just continue to trend, We'll see.
Yeah. It was interesting on that podcast, they were talking about how do we judge ourselves as a country? Is it by our GDP, or is it by how we care for our elderly and our children and our sick? And that we need to take a moment and reimagine how we treat our caregivers in this country, because for the most part, they're very underpaid.
And burnt out.
And burnt out. And they're burnt out because they're underpaid. So they have to work all these extra hours to try to make the bills. And so now you have this caregiver working 80 hours a week and is just burnt out, not taking care of themselves,
right.
not their best version of themselves at home.
That's right.
Right? And then they're back at work and maybe they're taking it out on an elderly person. So, you know, it's a cycle. You really need to look at the whole thing. And an interesting thing that they mentioned too is most caregivers are women and most caregivers are Black. So these are two areas where that they're not necessarily being looked at for raises all the time, right? Like women and men, there's always kind of a discrepancy, right? And then, you know, you have somebody who's of a different descent, and then they're also not getting, you know, looked at for a raise. And so it's a really interesting problem because they're so important, and 10,000 people a day turn 65 in the US. So the caregiver burden is getting bigger and bigger.
Yeah.
So it really needs to be reimagined. They need to look at them as the really special part of the country that they are.
Yeah. And it's really important that you pointed that out, because it's definitely not recognized and given enough credit and praise for what they do.
Yeah. And it's hard. I mean, being in a home with a dementia patient and they're asking the same question over and over and over and over again and remaining patient, that's difficult. A lot of families can't handle it. You know, they need a break. So I think that's another area you're going to see some movement in.
So we ask our guests 2 questions at the end of our podcast.
Okay.
The first one is, when do you feel like you're in your element?
I think when there's a really hard problem. I love a good problem. Because for me, like, no is not an answer. There's always a way to get around it. And I thrive in those moments. The really difficult moments, those are the ones that, and maybe it's the ICU part of me, like that's where I'm always thinking 16 steps ahead. And then when you give me something that I don't have 16 steps, I'm like, ooh, you got me, but you're not going to get me for long, you know? And so I really enjoy those things. It's funny because a lot of the people here in New York call me the fixer. If you have a problem, you call me and I can give you an answer.
Wow.
Yeah. The other day, I had a gentleman call me and he said, I need you to bring on your psychiatric doctor to write the orders for this patient because they moved out of state and they can't get their doctor from the previous state to write it anymore. And I was like, well, I mean, you're going to pay thousands of dollars to onboard this concierge physician to write meds for a month until you find another physician. I was like, this doesn't really make sense. I was like, do they have friends in the state that they, are still in?
Yeah.
And he was like, yeah. I was like, why don't you just have them go pick up their meds from the pharmacy and ship it to them? And he was like, that's a really good solution. So, like, to me, it's usually like, fairly simple. Like, it didn't need to be that hard, Right. So when you give me a really hard problem, I'm like, yes, let's go,
Nice.
Yeah, that's a great answer.
Right? Yeah.
Cool.
And our second one, it's not really super health related. We just love music, and you were playing beautiful music before.
Thank you.
Yes.
What do you feel like is a perfect song?
Anything Van Morrison. That's what plays in it. That's what plays in my office all day long.
Wow.
The Van Morrison radio. My favorite song is "Someone Like You."
Wow.
I love that song.
Wow.
But I would say anything Van Morrison or Frank Sinatra. That's usually what plays in my office all day.
I love that.
Yeah, it just puts me in the mood to solve problems and get stuff done and keeps me in the right headspace.
So, Jeannie, thank you so much.
Thank you so much for coming, guys. This was really, really nice.
Oh no, it was so generous of you to offer up your space, beautiful space.
Thank you.
But more so, I mean, like the awesome conversation, learning more about you, Commodore, and all the awesome stuff. I want, it's just, we need more people to know about what you guys are doing. That's why I think this is.
Thank you.
Yeah, it's really
It
special.
means a lot that you guys asked us to do this, so thank you. It means a lot to me. It means a lot to the team.
No, thank you,
Thank you.
So, and what we're gonna do, guys, is we are going to link like how you guys can get in touch with Jeannie and Commodore in the show notes. We're also going to link information about the foundation as well.
Thank you.
Okay, so that you can look into that and hopefully also support it in your own way.
Mm-hmm.
But other than that, thank you guys, and we will see you soon.
Thank you.